Good morning, everybody. First of all, I'd like to thank the Canadian Academy of Health Sciences and Dr. Carol Ebert for inviting me here today to speak. It's truly a privilege to be here today. And Eric, I know you said we could have had this meeting 2 years ago and maybe last year, but from my perspective, I think this is the right time. We are really proud of our Pan-Canadian framework, which I will talk about in a few minutes. And I think that there is momentum, there is political commitment, and I think Canada is back and ready to go. So first of all, before I start, greetings from Dr. Teresa Tam. She could not be here today. She's got other issues that she needs to deal with. But certainly greetings from her. But before I begin, I'd really like to thank Dr. Sprenger for his thorough overview of the international perspective on antimicrobial resistance. We are only too aware of the global nature of this threat. At times, the scope of this challenge can seem overwhelming. But I take reassurance, however, in the messages that I've heard many times that important progress can be made when individual nations take concerted action at home and at the same time support global efforts. This is precisely the approach we are taking here in Canada, and it is my pleasure to be here today to share with you the Canadian perspectives on AMR. To do that, I want to start by setting the stage and giving you a snapshot of what AMR looks like in Canada right now. Depuis plus d'une décennie, le volume d'ordonnances d'antimicrobiennes chez les humains au Canada est resté relativement stable. En 2014, environ 63% des enfants de 10 ans à 14 ans ont reçu un antimicrobien. Chaque année, plus de 20 000 patients hospitalisés au Canada ont développé une infection résistante aux médicaments antimicrobiens, et ce, malgré une diminution de taux de certaines infections. For example, rates of MRSA in hospitals have declined by 25% in 2008. However, in 2017, it's estimated that about 4% of hospitalized patients will become infected with MRSA. Rates of vancomycin-resistant enterococci have also declined since 2012. But the rates of both these infections still exceed those observed in the early 2000s. And it is not just in hospitals where we are seeing these problems. Community-associated MRSA were relatively low until 2005, when a dramatic increase, greater than 400%, was observed. Since that time, community-associated MRSA infection rates have remained relatively consistent. Rates of Neisseria gonorrhea increased by more than 43% between 2004 and 2013, and more than 50% of these cases were resistant to at least one antibiotic. When it comes to antimicrobial use, in 2013, approximately 1.4 million kilograms of medically important antimicrobials were distributed and/or sold for use in humans, animals, and crops in Canada. 78% of those antimicrobials were used in food-producing animals. This is almost 4 times more than the portion sold for human use when adjusted for weight and volume. 73% of antimicrobials distributed for use in animals in 2014 were in the same classes as those used in human medicine. As you know, this increases the risk of resistance developing and reduces the treatment options available for human infectious diseases. In terms of how we stack up internationally, the answer really depends on which type of use you look at. Lorsqu'il est question de l'utilisation d'antimicrobiens pour la santé humaine, la consommation au Canada est modérée par rapport à celle des pays de comparaison en Europe. Plus particulièrement, 93% de l'utilisation des antimicrobiens chez les humains survit dans la collectivité. Le Canada a place à l'amélioration quant à l'utilisation d'antibiotiques chez les humains, des lacunes au niveau des pratiques de gestion et des efforts en matière d'éducation et de sensibilisation, ce qui augmente la menace d'une plus grande résistance aux antimicrobiens. There is an immediate need for evaluations, impact assessments, prescriber audits and feedback, and research to identify the best and most promising practices, particularly at the community level. This is a need not just in regard to prescribing practices, but in all areas of intervention, including infection prevention and control, diagnostics, alternative treatments, and vaccine development. A look at our antimicrobial use in the agri-food sector, however, paints a very different picture. Here, Canada ranks significantly higher than most European countries. In fact, we are higher than about 75% of them, even though many agricultural sector organizations have introduced guidelines to reduce use. All this to say, the issue of AMR in Canada is both complex and pressing. Canada has been active on AMR. C'est la raison pour laquelle, depuis bien des années, les organismes des secteurs publics et privés travaillent afin de réagir à la résistance aux antimicrobiens partout au Canada. Le cadre fédéral sur la résistance aux antimicrobiens a été publié à la fin de 2014 et a été suivi de près par un plan d'action fédéral en mars 2015. Il s'agissait de la première étape en vue d'élaborer une approche plus cohérente visant à faire en sorte que tous les ministères et organismes fédéraux pertinents travaillent ensemble en vue d'atteindre des buts et des objectifs communs. In total, seven federal departments committed to undertake the activities outlined in these documents. There were 4 from the health portfolio, so there was Health Canada, the Public Health Agency, CIHR and CFIA, Agriculture and Agri-Food Canada, and then Innovation, Science and Economic Development Canada, so ISED, and the National Research Council. Internationally, the Government of Canada endorsed the World Health Organization's Global Action Plan on AMR in May 2015 and reaffirmed its commitment to the principles of GAP at the United Nations General Assembly High-Level Meeting on AMR in September 2016. Broadly speaking, the federal response is built on 3 interconnected pillars: surveillance, stewardship, and innovation, with an overarching emphasis on leadership. In terms of surveillance, the Public Health Agency of Canada established the Canadian Nosocomial Infection Surveillance Program, or CNISP, in 1995. CNISP collects surveillance data on select antimicrobial resistant organisms in participating Canadian sentinel hospitals with 10 provinces. It is the only national surveillance system in Canada collecting both epidemiological and microbiology data regarding healthcare-associated infections. Further, the Canadian Integrated Program for Antimicrobial Resistance Surveillance, or CPARS, was established in 2002 to monitor antimicrobial use in animals and humans, as well as antimicrobial resistance in Salmonella throughout the food chain. CPARS is coordinated by the Public Health Agency of Canada in partnership with Canadian Food Inspection Agency, Health Canada, and the provincial health and agricultural ministries. The information collected is used to support the development of evidence-based policies to control antimicrobial use in hospitals, the community, and agriculture settings, as well as to identify appropriate measures to slow the spread of AMR in humans, animals, and the environment. More recently, in March 2015, we launched the CARS, which is the Canadian Antimicrobial Resistance Surveillance System. CARS integrates human and animal data from 9 different surveillance systems, including CNISP and CPARS, into a single annual report at the national level. CARS surveillance reports were released in 2015 and 2016. The 2017 report is under development and is scheduled to be released in November in advance of the Antibiotic Awareness Week. La gestion est un élément clé de notre travail qui vise à préserver l'efficacité des antimicrobiens. Ici, nos actions sont axées sur l'élaboration de directives sur le traitement et l'augmentation de la sensibilisation du public et des professionnels de la santé. Since 2014, the Public Health Agency of Canada has developed a number of resources to help the public and healthcare professionals understand the risks of AMR and what they can do to help reduce the risk. For example, the Public Health Agency of Canada has developed specific guidance for the diagnosis and treatment of antimicrobial resistant gonorrhea infections as part of the Canadian Guidelines on Sexually Transmitted Infections. These guidelines were created as a resource for primary care and public health professionals for the prevention, diagnosis, treatment, and management of sexually transmitted infections. Perhaps most importantly, the Public Health Agency of Canada has brought together the many organizations and experts to join forces to take action on stewardship. A good example of this is the National Action Plan on Antimicrobial Stewardship that was developed with our leading partners, Healthcare Can, and the National Collaborating Center for Infectious Diseases, and input from over 50 experts across Canada. As part of our awareness and education activities, the Public Health Agency of Canada undertook an antibiotic awareness campaign in 2014-15 directed to the general public, parents, and physicians. A baseline study was done in advance of the campaign's launch so that following the campaign, we would be able to assess its effectiveness. The results demonstrated that the campaign had significant reach and impact, and based on these findings, products were also developed and shared in 2015-16 and 2016-17. In terms of innovation, Canada has a strong academic and government research capacity and funding mechanisms in place to support AMR-related research. Between 2011 and 2012 and 2015 and 16, the Canadian Institutes of Health Research, so CIHR, invested $96.6 million in AMR research, with $20.2 million in the 2015-16 alone. As part of this investment, CIHR was given $1.8 million per year in budget 2015 to support research to better understand and address health challenges posed by AMR. CIHR was a founder and is a major funder of the Joint Programming Initiative on Antimicrobial Resistance. This collaboration amongst 26 countries coordinates international research funding and supports collaborative action to fill knowledge gaps on AMR in key areas. Through the Public Health Agency of Canada's National Microbiology Lab, Canada also collaborates internationally on emerging AMR issues. These include novel diagnostic and reference test development, as well as the provision of laboratory assistance. Comme vous le savez, la résistance aux antimicrobiennes est une question complexe qui touche de nombreux secteurs, ce qui en fait un enjeu plus difficile à aborder et à maîtriser. En vertu du système de gouvernement fédéral du Canada, la réponse à la menace qui représente la résistance aux antimicrobiennes exige la collaboration de nombreuses administrations gouvernementales et organismes qui font autorité, qui agissent chacun en fonction de leur mandat et de leur domaine de responsabilité respective. Although FPT government's roles and responsibilities are distinct in these areas, they complement each other. The federal role in AMR involves promoting health and preventing and controlling disease, building the evidence around AMR through activities such as surveillance, and facilitating innovation. The federal government also plays an important role in mobilizing partners, both domestically and internationally, around collective action on the issue. The provincial territorial role in AMR is more direct, given the responsibility for healthcare settings and the delivery of healthcare services. This involves establishing policies and standards related to infection prevention and control for healthcare settings, education and awareness building efforts around appropriate antimicrobial use, and monitoring of AMR and antimicrobial use in their respective jurisdictions, which contributes to a better understanding of the issue at a national level. Other stakeholders such as academia, the pharmaceutical industry, the agri-food industry, healthcare institutions, and healthcare professionals, both from human and animal health sectors, professional colleges and associations also play an important role in mitigating AMR and supporting appropriate antimicrobial use. Because of the complexity of AMR and the number of roles and responsibilities at different levels, over the years many activities to address the issue were undertaken independently. Although some successes were achieved, there was an overall lack of cohesion and the work was uncoordinated. We recognize that we will only achieve success through a One Health approach, which recognizes that the health of humans, animals, and ecosystems are interconnected. This involves applying a coordinated, collaborative, multidisciplinary, and cross-sectoral approach to address potential or existing AMR risks. Now for the Pan-Canadian framework for AMR. Même si le gouvernement fédéral a réussi à aborder certains aspects de la résistance aux antimicrobiens, il reste des lacunes importantes. Pour les aborder, l'Agence de la santé publique du Canada a dirigé les efforts de concert avec nos ministères fédéraux partenaires, les provinces, les territoires et les intervenants afin d'établir une approche pan-canadienne à la résistance aux antimicrobiens sous l'approche Une Santé. Networks were developed at the technical level and cross-cutting governance structures were established to leverage the expertise of internal and external stakeholders across the human and animal health and agri-food sectors. And I'm really pleased to say that just last week on September 5th, our new health minister, the Honorable Jeanette Petitpas-Taylor, along with the Honorable Lawrence Macaulay, Minister of Agriculture and Agri-Food, released our Pan-Canadian Framework for Action on AMR. This required 28 ministers across the country to actually concur with the framework. It was no easy feat, I can tell you. We worked on it for days, months, and I think years. The Pan-Canadian Framework establishes direction for a national approach to AMR and identifies opportunities for action under 4 pillars: surveillance, stewardship, infection prevention and control, and research and innovation. Mirroring the development process used for the Pan-Canadian Framework, a Pan-Canadian Action Plan will be developed in collaboration with stakeholders and provincial and territorial partners. The Pan-Canadian Action Plan will define specific commitments, measurable outcomes, and timeframes to implement the framework. Together, the framework and the action plan will map out current activities being undertaken and look to identify best practices that can be applied nationally, but also provide the flexibility for provinces and territories to implement actions suitable to their individual requirements. And it will also be used to increase national coherence, enable federal organizations to build on the federal framework and align with the global action plan. So looking ahead, nous vivons une période palpitante. La publication du cadre pan-canadien est un jalon important car son élaboration a nécessité une collaboration multisectorielle sans précédent. Les structures de gouvernance plurigouvernementales et multisectorielles qui ont été établies afin d'élaborer le cadre ont été soulignées par les pairs internationaux comme étant un exemple solide de l'approche Une Santé en action. Stakeholders exhibited great willingness to come to the table to discuss cross-cutting issues Going forward, it will be critical to maintain this momentum by working together and committing to concrete activities to implement the opportunities for action under each of the 4 pillars identified in the framework. Because a great deal of work still remains to be done, the Pan-Canadian Action Plan will provide the space to collaborate and solicit your specific contributions to bring the Pan-Canadian framework to life. Many of you here today are already direct stakeholders on the issue of AMR. You may work in human health or animal health or in the agri-food sector. I believe that you, Academy Fellows and participants in today's forum, can play an important role in helping us shape our national approach. I'd like to know how you think you can best contribute to the Pan-Canadian framework on antimicrobial resistance from your own positions and perspectives. You are the AMR experts, so much work is pressing. So where should our attention be focused, and which stakeholders need to be involved? What are Canada's strengths with respect to AMR? How can these best be leveraged to develop Canadian leadership in AMR, both domestically and internationally? How can we raise the profile of AMR as an issue of concern in industry and academia and among healthcare professionals? How can we win commitments from leaders in each of these sectors to contribute to the Pan-Canadian Action Plan in their own areas of expertise? These questions and more will be part of your deliberations over the next 2 days, and we look forward to hearing your thoughts and advice to help us move forward. Pour réussir, nous avons besoin de votre aide et de votre soutien, ainsi que l'aide et le soutien de bien d'autres personnes. I want to thank again the Academy for giving me the opportunity to speak, and I'm happy to answer any questions of clarification. Thank you very much.
Thank you, Dr. Mithani. It's encouraging to hear of the political will to act right now, but of course there is work to be done in Canada, especially when it comes to antimicrobial sales in animals. So looking forward to hearing more. We now again have time for some questions for Dr. Mithani, and there are microphones around the room.
Thank you very much, Dr. Mithani. I'm over here if you're looking for me. On your right, over here. Hi. Thank you very much for your comments. I have two quick questions. One, when is the deadline for the release of the Pan-Canadian Plan? We've got the framework. There's no deadline in the framework. I'd like to know when we're actually going to see that. And secondly, there is mention in the framework of benchmarking, which is a practice that has been used with enormous success in Holland and in Denmark, and has been actually in place for more than a decade in both of those countries. And there is some mention in the framework of benchmarking, but I'd like to ask you personally whether you would support following the Dutch and the Danes in their extremely successful use of benchmarking based on full data release from farms.
Thank you very much for your question. So as far as the Pan-Canadian Action Plan goes, it's very difficult to give you a deadline, and the reason is that there is no sense in having a document that cannot be implemented. We can come up with a few meetings, conferences around and consultations, getting people together and talking about a document that will be an action plan. But I think what's really important is to engage people, to get their buy-in, to get commitment, and to be able to look at what is already happening around AMR and some of the stewardship strategies that people are using. What are we going to do around infection prevention and control, around surveillance, around research and innovation? So I think that the action plan, there will be consultation, but having a document and having a deadline, and we learned that with the Pan-Canadian framework. We had wanted the Pan-Canadian framework, 6 months ago, and we were not able to get that document done. So I would hate to give a timeline and be wrong. I would rather say, let's look at the way we want to do these actions. Let's look at actionable, tangible deliverables, be able to document them, and then look at the gaps. So I do not have a timeline for that, but if I do have support and commitment from people like you in the room, then I think we can come up with a deadline, but I wouldn't want to give one right now. And so that's the reason. With respect to the benchmark, again, Canada is not going to be reinventing the wheel around strategies that are already being used. So one of our commitments is to look at internationally what is going on and where strategies and where activities are conducive to the Canadian environment. Those will certainly be embraced and will be used. Again, in order to get buy-in and in order for people to do the work, it's really important that they are able to embrace what's in the action plan and what actions we are committing to take. So, my answer is yes, we will be looking at the Danes. We will be looking at many of the European countries that have done really, really well. The work, the information that I gave you is actually quite disturbing. Although, you could be complacent and sit and say, well, we are kind of in the middle of the pack. Well, being in the middle of the pack is obviously not good enough.
Yes.
So I was part of this Pan-Canadian framework, one of the committees, the Research and Innovation Committee. I was also one of Canada's representatives to the United Nations in 1994 to discuss antimicrobial resistance. So this is hardly a new issue. And I'm really concerned that we're putting out report after report after report in Canada without really any solid action. And it distresses me that we did these reports in a great hurry last year, and then it's a year later before the report actually even gets released, and I know there was a lot of political flack around it. But at the end of the day, I'd like to see something actually done, and not only just something done, I'd like to see something done that we in Canada can do better than everyone else in the world. I don't want us to be incremental, I want us to be leaders. At least in this report, I see a lot of fairly vague, opportunities for action. I would like to see action. One action that could be taken, for example, is there's mention of networks here that could be set up and funded and start operating really quickly. If actual money was put on the table, I see no mention of money on the table. Maybe that's in the oncoming action plan. So I like the idea we're doing this, but I want to move much faster.
I echo your sentiment. I think that we've been talking about AMR for a very long time. I think we are at a situation right now where we've got the political will, where we've got a national approach, where we've got provinces concurring with the fact that this is an issue and that we need to move forward. We know that there are treasures of activities across the country, but we are really fragmented. We don't have a coordinated approach. There are strategies in the West that the East could use and vice versa. There are some unique regional differences and challenges that we have. And the only way we would be able as a country to make any progress, I think, is to have a coordinated approach and to be able to monitor and start reporting on results and be very honest about the results that we report on. So that is coming, and that's why I think that this is an opportune time when we have everybody committed to taking action.
Please identify yourself before you ask.
Gary Garber, Public Health Ontario. Thank you for your presentation. I did note that the data you presented on things like VRE and MRSA were from 2014. And it might be of interest for this group to know that in Ontario over the last 9 months, our VRE rates have actually doubled, particularly driven by hospitals who have stopped VRE screening. What commitment can you make on behalf of Public Health Agency of Canada to improve the timeliness of the surveillance data that we're all submitting to, so we have data that we can actually act on in a more timely fashion?
I think that time will tell as we have consultations around collectively what kind of commitments we can all make. This is not just about the Public Health Agency. This is about us as a nation. It's about us as a country. It's about us as provinces, territories, working together. The power of the Public Health Agency is just as a convener, as a facilitator, and being able to bring people together and making sure that actions are there. So absolutely, we will make a commitment to make sure that we are coordinated, that best practices across the country are identified and are available for sharing and embracing as we move forward.
Thank you for the two amazing presentations. I'm John McLaughlin, Toronto Public Health, Ontario. We're sitting not really together, but a different perspective. Dr. Sprenger's presentation gave many challenges for all of us, but I'd like to explore the idea of ECHO versus EQUI. In particular, the mandate for the CCA domain, it's like economic benefit, and I see the framework here that you just presented referring to the cost-effective delivery of new product and other aspects of economics. But the EQUI, the equity, is actually really important in this, and I think that Dr. Sprenger has given some demonstrations of how vulnerable populations are actually really suffering, and that's at the global level, but in Canada that's also quite relevant too. And any concept as to whether equity is also going to be built into the delivery of this framework?
As we've, if you look at the Pan-Canadian framework, it's a very high-level document, and as you probably know, being from Public Health Ontario, getting provinces and the federal government to actually concur on something is very difficult. So I have to say that EQUI is not something that we've specifically looked at. But again, the opportunity to have discussions around the Pan-Canadian Action Plan and what that would look like is a real opportunity to look at many aspects. So some other aspects that I think we have not really included, for example, is the whole issue around environment and how the environment plays a role in antimicrobial resistance. Again, from a federal perspective, we have just begun to bring in our colleagues from Environment and Climate Change Canada and Department of Fisheries and Oceans, and it's obviously my bias having been in those organizations before, but the fact that, at the end, it is about many other things. AMR touches many areas, and we need to focus on that. So it's something we haven't specifically done, but there is the opportunity.
Yes, we have a question here.
So this is Jerry Wright from McMaster University. I have a comment and then a question. The comment is on innovation, and I've seen this over the last few years, and I'm actually a little bit troubled by the fact that innovation has got its own column. It seems to me that innovation should be horizontally distributed throughout all of this. We can't just do things the old way, and I don't like that language. I think it should be embedded in this document that we have to be innovative on all of these pillars. The other question that I have, and you mentioned briefly the pharmaceutical industry, and there was a question prior to that in a previous talk about the role of the pharmaceutical industry. I think it's fair to say that we have all agreed that the pharmaceutical industry has completely abandoned this area. The funding models currently in place don't fit, but where the gap is being filled is in small and medium-sized companies. There are significant efforts in Europe in the New Drug for Bad Bugs initiative, in the United States with the Carbex initiative, with the help of the Wellcome Trust from the UK, specifically encouraging small enterprises to innovate. That's where the big exciting research is coming from. That's where the breakthroughs are coming from, not from the large pharmaceutical industries. And my question is there any thought, any role for those kinds of industries here in Canada? I know that there are quite a number of them that are trying to innovate in this area. Where do they fall into the Pan-Canadian framework?
So your point well taken, that innovation should be sort of more overarching in terms of AMR. But in order to make sure, I think that there is also a focused effort around innovation. It was left as a pillar, as a specific pillar, so that there could be reporting around research and innovation that could be done. But you're absolutely right. I think it's something that should be overarching and that will affect all the other three pillars. With respect to, the kind of organizations and activities and strategies that we have in international countries like CARB-X, that you gave an example for, it's important to recognize that our Minister of Science, Minister Duncan, has now made AMR one of her science priorities. Having a science minister actually focus on a specific priority such as AMR from a very political perspective is huge. And so I think that as that unfolds in terms of how that priority is going to manifest into some actions, we will wait to see.
Yes. Yes. Is there a microphone? Okay. Bear with us.
John Conley, University of Calgary. So I was involved in the meeting with the Deputy Minister of Health in Aylmer, Quebec in 2002. We actually formulated a Canadian action plan. Then a number of things came along. There was SARS, there was influenza outbreaks, and now I look at the current environment and there's a renewed interest, another commitment to move forward, to create another action plan. And I echo Bob Hancock's comments that many of us have been waiting patiently to actually see some tangible outcomes that are going to occur. So my question is, what are the risk mitigating strategies? Because we now have an emerging opiate crisis. H3N2 influenza south of the equator has been very bad, so we may get a bad influenza year. Zika virus maybe march northward. So there's always things that come into play that torpedo the agenda. This is like the slow-moving tsunami. I always call it the crisis in slow motion. So my question is, what are the risk mitigating strategies to ensure that this does not fall off the agenda as it did in the past, and then you have this doldrum of many years before it arises again? So please address risk mitigating strategies to make certain the eyes are on the prize.
All right, so risk mitigation strategies, I think that the fact that we do have a pan-Canadian framework that has been signed off or concurred by all the provinces and territories is, I think, significant. The fact is that we have chosen not to talk about yet another document with a deadline, which is the action plan, which could be a document that could stay on the shelf forever with no real tangible actions. And so there is a real effort. We've never had so many departments come together at the federal level to say, okay, what is my role in AMR? And so the momentum, even from at several levels, is there. There is the bureaucracy, so the federal development. So we have a deputy ministers group that get together on a regular basis to say, what is my responsibility based on my area, my mandate around AMR, and what is it that I need to deliver? It's not about, it is about getting things done. It is not about how much more money we will get. It is about what can we show, what are the gaps, and where do we need to move forward. So I would say, trust me. And I know that that may be hollow or shallow, but I think the momentum is there. I think that the political will, the fact that there is such an international focus, makes it even more important and pressing because the momentum is there.